Good afternoon. My name is Rashonda Washington, and I'm the Executive Assistant at the Urban Chamber of Commerce. I would like to start by thanking everyone for joining us for today's COVID-19 vaccine webinar. I would like to remind everyone that all mics will remain muted. If you have any comments, please insert them into the chat. We will be reading them throughout the presentation. If you have any questions during our Q&A, you can add them into the chat, or you can use the raise hand feature where we will unmute you and you can ask your question. Now I would like to turn things over to our moderator, President of the Urban Chamber, Ken Evans.
Thank you very much, Rashonda. And again, thank you and welcome to everyone. We hope this is going to be a great dialogue. The way we have it formatted is we'll be getting a short presentation from each of our presenters, and I'll make those introductions shortly. But the bulk of the time this afternoon will be spent on being interactive, engaging, and making sure that we answer the questions that are relevant to you. The reason why we wanted to do this presentation is for two reasons. Number one, we recognize that there's quite a bit of concern regarding the vaccines, and beyond that, what we also recognize is, unfortunately, all too often there can be misinformation, rumors, well-intentioned but partial information out there. And our goal this afternoon is to provide some education. We're not necessarily here telling people that they have to get the vaccine, but we just want to make sure that you are armed with the information necessary to make an informed decision. So that's number one, making sure that we get good information out there. The second reason why we're doing this is because whether you're an employee, whether you're a business owner, or whether you're a clientele that goes, our client that goes to a place of business, whether someone gets the vaccine or has not received the vaccine could potentially impact you in one of those three roles. So we wanted to make sure that in the best interest of providing the highest level of possible protection, ultimately for our small business members, our nonprofit members, and then our corporate partners and members of the Urban Chamber, that we got information out there about the vaccine, what it's intended to do, again, with the intent that we provide information so that our businesses can best protect themselves when it's all said and done. So to that end, we have two distinguished presenters here this afternoon. The first individual that'll be doing a presentation is Dr. Legin. He is the Chief Medical Officer with the Southern Nevada Health District. So that's a great individual to get some original source, valid, credible information from. And then in addition to that, we also have Sharon Lamberton with us here today. She is a Deputy Vice President for Pharma, and Pharma is the pharmaceutical association that represents a couple of the major players that have been responsible for the development and the eventual deployment and distribution of at least one of the vaccines. And she'll cover that in her presentation. So without further ado, what I'd like to do is have first Dr. Legin go through his presentation, and then following that, we'll have Ms. Lamberton do her presentation. And then, as I mentioned, the bulk of today's event will be Q&A. And if you think of questions along the way, what we're going to do is let them get through their presentations. But so you don't forget your questions, please type them into the chat room as we go, and then I will go through and read them in order that they are submitted. So without further ado, thank you and welcome, Dr. Legin, and I will queue up your presentation.
Okay, thank you, Ken.
Okay, it should be there now.
Yeah, it's there, right, thank you. So we just could move to the next one, so can go. Okay, thank you. Well, we will be talking about the vaccination campaign today, but I wanted to just briefly remind everyone the reason why we are vaccinating Clark County, same as our country and most of the world, have been suffering from this pandemic since a year ago. So as you can see in that chart, there have been two main waves of cases here in Clark County. Right now, it looks like the incidence of the report of new cases in Clark County is declining since about 2 weeks ago. And it looks like we already hit the peak of this wave, but still we are, monitoring the situation and see what happens. So this is the situation in Clark County right now with COVID. We have more than 200 cases in the county, and unfortunately, we have already more than 3 people who lost their life due to COVID here in the county. Please. And this is the state of Nevada priority lanes for the vaccination campaign. It was recently modified. Initially, the state had a priority list, and about 2-3 weeks ago, they changed that into these 2 priority lanes. And what it means is that the state will be offering vaccines based on age groups, but at the meantime also will be offering vaccines based on a workplace, because in this case, frontline essential workers and some others. So right now in Clark County specifically, we are offering vaccines to those who are 70 years old and over. And also we are offering vaccine to the remaining of healthcare workers and also those who are in public safety and security, as well as frontline community support workers. Would you please? And this is specifically where we are in Clark County in terms of those groups. So the main area of, I would say, misunderstanding of issue right now is for people who are community support personnel, and how far are we going? Well, right now we are going through education, child care workers, and then the continuity of governance, which is the county and city level and state employees, as well as frontline workers as defined there. Please. Well, so far, I mean, we in Clark County right now we have more than 100,000 doses administered in Clark County. I mean, this number was last Saturday, but between Saturday and today we had about 20,000 more doses here, and this is about 4% of Clark County population. Perhaps you might have seen in news reports recently that vaccine allocation to the state of Nevada has been less than actually have been allocated to most states across the country, and it also reflects in the vaccination campaign that we are performing here right now. The United States vaccination rate until Saturday, because those numbers are until Saturday, was about 6% of the population. So we are running behind on that regard. Next one, please. These are the main centers where we are offering vaccine here in Clark County. As you can see on the screen, the Cashman Center, Roseman University, also the Health District is offering vaccine at 2 centers, our main facility at the Capitol Boulevard, and also at the Western High School and Mac Middle High School that started actually yesterday. Also, it's very important to mention that the state has an agreement with the pharmacies, Walgreens and Smith, that they are offering vaccines to seniors. They started doing that last week, January 20, and it's something that is going to be of great benefit to our seniors, because they don't have to go to the main vaccination sites. Still, we are offering vaccine for seniors at the main mass vaccination site, but also the vaccine will be or is available at in the neighborhood at those pharmacies. Thank you, Nes. And so, and finally, I wanted to share with you the sites where you actually can register for vaccination if you are within any of those priority groups. It could be at the Southern Nevada Health District website, but also at the Immunize Nevada website that is collaborating with the state for this immunization campaign. And I will stop here until we have the questions later. I think
thank you very much, Dr. Ligon. Appreciate that presentation. And what we will do is we will share those links in two places. We can send out email to all the attendees. And then in addition to that, if you're not aware, we do have an Urban Chamber COVID-19 resource page. We can make sure that we publicize the information there. So thank you again, Dr. Ligon. What we'll do now is ask you again, make sure that you type your questions into the chat room, and then we will make sure that we come back to them. And again, as I just mentioned, we will make sure that we publicize and share those website links, both email as well as through our participation or our COVID-19 website. Now what I'd like to do is transition to a presentation by Ms. Sharon Lamberton. She's the Deputy Vice President for Pharma, and she's going to give us some more information about the actual background for the development of the vaccine and related topics.
Thank you, Ken. It is an honor to be here today, and I want to thank you, Ken, for all that you do as president of the Urban Chamber of Commerce. My colleague, Flo Kahn, Asher Lysick, and Hannah Green, who's also on the webinar, really appreciate your work. You do a great job, and we want to be here not just for this webinar, but later on as a resource. So let me know if anything comes up, as I'm sure it will as we continue battling this pandemic. And with that said, I wanted to go into my next slide, if you will. Thanks, Rashonda, for helping me. When we first saw this pandemic come about, our trade association, which represents 33 different member companies that create brand medicines, started jumping into action. We had never seen anything like this before, even though we had fought SARS virus, Ebola, H1N1, a number of other things, but this was unlike anything we had ever seen. It moved rapidly, and we moved quickly to decode this virus in less than 4 months, as compared to 20 months that it took us to decode the SARS virus. But here, this slide represents what were we doing that made a difference, and what was it that you and policymakers there have done in Nevada that have strong biopharma industry innovation protections. Because if we didn't have the foundation of policies and the respect for the scientific innovation that we had underway, we couldn't have been as far as we are today, which I'm happy to say 2 vaccines already approved, and within the next 2 weeks, maybe 1 more approved, and then the next couple weeks, a 4th, we hope. So what we did was we looked immediately what was on our shelves that we already had: antivirals, antibacterials, what could be used to treat or fight this awful virus, whether it was a vaccine or a treatment. We also moved all of our scientists, all hands on deck, even though we had critical clinical trials underway and still do for a number of other disease states. We wanted to shift all of our resources that we could to fight the pandemic. And then finally, really sharing things in real time. We were sharing with the Chinese Medicine Association. We were sharing with the European Medicines Association, folks we haven't typically collaborated with, and folks we've been competitive with. we decided to link arms and said, okay, whatever we're looking and learning, we are going to share. And that allowed us to actually commit to manufacturing drugs before it was ever approved. So we have manufactured millions of doses, and even J&J, who's next up in 2 weeks, those folks have already produced millions of doses. Whether or not they have to throw it out if it doesn't get approval, emergency authorization use from the FDA, we are that much further ahead when that green light is given. So I just wanted to mention that to you as we go into the next slide. This next slide really addresses an important piece, and this is what we are doing to ensure clinical trial diversity. And when I say that, as a nurse who worked at NIH in clinical trials in neurology before going to pharma, it is very important that when we're looking at clinical trial protocol, that the treatment population for which that drug is supposed to work is reflected by the clinical trial participants. So when you look at COVID, which has disproportionately impacted our communities of color, we sure want to make sure those clinical trial candidates are reflective and not just of racial disparity, the racial makeup. We want to make sure there are gender diversity. There's medical background diversity. Do we have diabetics? Do we have asthmatics? Do we have the other different portfolios that we need to make sure that that treatment, once approved, is efficacious for everyone? But I'm so proud because of 18 years at pharma, I have never seen our industry unite and say that we are going to address the elephant in the room. There's not enough diversity and really attention to clinical trial diversity. So what are we going to do about it? We didn't just release principles that are going to collect dust. We committed, all of our companies committed voluntarily to ensure that we're educating the medical community on what is a clinical trial and what isn't it. Promoting diversity and inclusion, trying to figure out what's the barriers to getting that diversity and that enrollment and retention in that clinical trial. And then how do we use data to enhance that information? So I'm really proud of that. And I wanted to make a quick mention of that, but an important one. Next slide, please. So this is one of my favorites because this slide changes weekly, but we have over 1,756 clinical trials underway to treat COVID or to have a vaccination for the virus. And you see it broken down into vaccines and therapies, but this is an incredible number. We've seen 2, as you know, approved for vaccines. We have several therapies that are already approved for those that do have COVID that can reduce the severity of their symptoms and reduce hospitalization and the awful repercussions that can come from COVID. So I'm happy we cannot forget about treatments. We talk a lot about vaccines. But what you might say, Sharon, how many of those 1,756 are in Nevada? Well, I'm happy I looked it up. It was 18 clinical trials are currently underway in Nevada for COVID. So very interesting. I can give you a breakdown, Ken and team, later on if you want to know exactly where those trials are. But that is reflective of the wonderful support and the great infrastructure that you have there in the state that's supporting our innovation. Next slide, please. So when you look at this, when you're looking at vaccines, you're saying, Sharon, gosh, it took less than 12 months to get 2 vaccines, but don't vaccines typically take longer? Yes, it takes 7 years on average to bring a vaccine to market. And guess what? 95% will fail. Only 5% make it, which is crazy to me because you need as many shots on goal then, because if you have 95% of what starts that's going to fail, you better have a whole lot to try out because we need it. And you might say, well, gosh, why don't you just perfect the 2 that have that are approved? We don't know a lot of what we don't know. Yes, we know that it's been approved. There's been clinical trial data, but some of those vaccines require extraordinary refrigeration temperatures, like -70 degrees under Celsius. Think about those underdeveloped countries that can't handle just normal refrigeration. So we need to have as many options. But with that said, the first 2 vaccines that were approved use mRNA approach. That's a novel approach, never been used by any vaccine. And it's using our own genetic code to mobilize and create antibodies that will fight against the virus. They're like mobilizing soldiers that stand at the ready so that when our bodies encounter COVID, they're ready to go and fight. Now that's different from the others that are coming up that use an adenovirus or a cold virus. So we see J&J and AZ that has a totally different mechanism of action. But the bottom line is the efficacy rates are super high. We only needed about 50% to achieve FDA approval. Guess what? It's over 94%, thank God. And I know the doctor who just gave the great presentation, Dr. Legan can add, this is just extraordinary to see those results. So we hope to see as many and high results on the other different mechanisms, but it's not a one size fits all. And this slide shows you there's a lot of different ways to create a vaccine. Next slide, please. So as we close out, I want to show you another good news slide because this is how many medications are coming up for approval. We already know that BioNTech and Pfizer approved, Moderna approved. Now we look under phase 3 on that right side and you see J&J and AZ, which is already approved in the UK. Let's get that approved here. That'll be even more shots available. You might say, well, gosh, can I choose? I think I might want the Pfizer over the Moderna, or could I choose between the 4? We don't have that luxury, but what I do know is the efficacy rate is astounding, and we're going to be lucky. Let's just grab any of them that are available so that we can achieve this vaccination and the immunities that our communities need to develop. Next slide. So with that said, there's a lot of challenges that our state of Nevada is facing right now and all of the states, because it's not just, wow, it's approved, done. We know, and we've been hearing the challenges. Do we have enough healthcare providers like myself that can get the shots into the arms of the patients that need it? Do we have storage requirements that are sufficient so that millions of doses don't go unwasted if the refrigerator temperature goes above what's required and it accidentally thaws where the vaccine is not as efficacious? Do we have enough doses, and do we have enough sites, creative sites? I've seen states create these point of dispensing, point pods, they call them, that are car washes, that are the YMCA, parking lots. They're unusual places that we can get people streamlined and using that social distancing that we need to get all the vaccinations in. But there's a lot of challenges. And so I'm hopeful that when we heard President Biden say that we're going to get we're not just going to get 1 million a day. We need to get over 1.5 million in vaccinated. I'm hoping we're going to see that vaccination rate improve. Next slide. And just in closing, this would be important if we didn't mention this. We know the toll that the virus has taken on the economy and on the pocketbooks of those who have lost their jobs in Nevada and throughout the country. And that means people that are taking medicines, like my son who has asthma. If he didn't have his inhaler or I couldn't afford his medicine, he would be in the ER. I would be missing my job. He would be missing school. Even if online, it's a lot of unfortunate consequences that will result. So our medication assistance programs, MAT.org, is a one-stop shop where you, if you're a nurse, a mom, a daughter, a loved one, a fellow church member, can type in the medicine that your loved one needs. And it'll tell you how many free or nearly free medication programs are available to you. You can be insured and still get it. You could have assistance programs and still get it. You could be underinsured, meaning you have insurance, but you still can't afford the medicine. All that to say, try it. It's a great tool, and they've expanded the 950 programs eligibility even greater since the pandemic started. So that concludes, I believe that was my last slide. But I just wanted to make sure this is the resources, but we're going to leave this time open, as Ken, as you had articulated early at the hour, that we want some interactive questions, and Dr. Ligon and I stand ready to help. Thank you for your time.
And what I'll ask Rashonda to do is to stop sharing the screen so that we can pull up all the panelists. Before I go a step further, I want to make a couple more introductions because they've been instrumental in making today happen. First and foremost, I want to say thank you and welcome to Hannah Green from Pharma. She's been a partner to the Chamber even prior to COVID. We were already working on the idea of making prescriptions affordable to as many businesses, especially small businesses. So thank you, Hannah Green, for joining us. In addition to that, thank you, Jennifer Zinn of Zinn's Public Affairs, for helping us put on today's event as well. Well, let me get to the meat of the matter, if you will, and that's making sure that this is as interactive as possible. I've picked up questions in the chat room as well as the Q&A, so I'll be making my way through those. What I will do is I'm going to start out with the chat, and the first question, and Dr. Legan, you may be able to answer this if you'll come back online. The question was, is there a way to register with the health district for the vaccine if you can't, I repeat, if you can't figure out a way to access the website? So like, is there a phone number or some other way to sign up?
Yeah, thank you, Ken. Yes, actually, there is a phone number that the state is releasing today. So the timing for that is pretty good. So it's going to be an 800 number. I don't have that with me, but it will be available on our website actually today. The state contracted a call center with a company, and they will be providing that services starting today. So people can call there and register as well.
Okay, and again, we're keeping track. Rashonda will help keep track of questions like this, and then we'll make sure that we, again, put that information out in an email to all the participants, as well as we have a COVID-19 website page. And Rashonda, at some point, if you can share the link to our COVID-19 page, that would be helpful as well. Next question is, when will people younger than 65 be able to get the vaccine? And either one of our presenters, if you want to hop in on that one.
Well, I'll start with just some good news. We had another clinical trial open today for 12 to 16-year-olds. I believe there are 2,000 of them enrolled today for Pfizer. And so we're excited that that is a recognition that we do need to expand it to those that are under 16, because that's what was studied. But it is ultimately up to the FDA to determine if this vaccination that's currently approved is safe for pediatric population. And while we like to have pediatric population studied, this is a pandemic, and this is a time we've never seen before. So it might be that the FDA rules that there's sufficient enough data to deem it safe on children. But I defer to our esteemed Dr. Legan, because he'll know from the medical perspective best, but from the industry perspective, we're encouraged to see that the populations are now enrolling 12 to 16-year-olds. Dr. Legan?
Right, thank you. Well, you're absolutely right. The current recommendation for Pfizer is 16 years and up, and for Moderna is 18 years old and up. And it is because of the clinical trials were focused on that particular population. So it is the same, I mean, similar to the issue with pregnant women, for example, that there is no information from the clinical trials on that regard because it was not addressed, and because of the challenge, of course, to address that population. But for children, there is no information from the trials. That's why it hasn't been included. What we know is that both Pfizer and Moderna, they are initiating studies into the younger population.
And then the follow-up question is, and I think this has to do with the distribution plan, when can people that are 65 and younger, like right now the cutoff is 70 and younger, when will people that are 65 and younger be eligible to, if, for lack of a better way of saying it,
sure,
come to the front of the line?
No, yeah. Well, the CDC or the federal recommendation today is to vaccinate 65 years old and over. But it's up to the states to decide what policy they implement. The state of Nevada decided to start with 70 years old and over right now, instead of 65 and over, recognizing the risk for both groups, because once you get into the older age groups, the risk for complications, severities, mortality, hospitalizations grows exponentially. But the main issue right now is vaccines. There is not enough number of vaccines in Nevada, at least from the beginning of this campaign, to really allow us to address most of the population needs. So we are trying to find the balance between protecting the elderly and the meantime that we allow for the community to start to open and of course incorporate services, and that's the reason why healthcare providers were the first group that was decided to offer the vaccine. But when we move into the 65 and over, it will be dictated by the allocation of vaccines that we receive from the federal government.
And I'm sure there'll be information publicized at the health district and related websites on where we are in the exact distribution cycle or plan. Next question comes from our Q&A, and it says, thank you for the information. Under the categories of who is eligible for the vaccine, there seems to be confusion regarding educators. What are the subcategories under educators that exist, and who is qualified? And the reason why they're asking is because there are educators that are in the administrative areas that are being asked to work, but they're being turned away for an actual vaccine appointment.
Okay, I see that's also back to me. Okay, well, the agreement that we have locally here in Clark County is actually that the bulk of the vaccination for educators is being done through UNLV. We have a site dedicated to that. They have been in conversation with the Clark County School District about, okay, within the school district, which are the groups that it should be vaccinated first, and it has to be done in a way that is consistent with the Clark County School District system plans to reopen. So that's there have been an ongoing discussion on that regard, and that's where they are right now. Now the specific question about why the frontline person is vaccinated or not, that really belongs more to Clark County School District, because they are the ones who decide within their community who receive the vaccine first, and that's the way it's being worked out.
Okay. And then the next question is, individuals that have lupus don't have immunity, what are their options?
Okay, I will start, and then if you guys want to continue. The recommendation for individuals who suffer any kind of chronic conditions or immune depressive conditions regarding those vaccines is that there is no contraindication for the vaccination unless they suffer of, or they have a specific condition that per se is a contraindication to the vaccine. Having said that, it's also recommended that they consult with the primary care physician or the provider for additional recommendation. But in general, if they don't have a specific contraindication to any of the components of the vaccine or history of anaphylactic, there is no contraindication.
Okay, and I think this next question will go to Ms. Lamberton. Is the Johnson & Johnson one-shot vaccine as efficient as the two-shot vaccines from Pfizer and Moderna?
Thank you, Ken. I think that the question is it as efficacious, maybe, right?
Oh yeah, I think that's what they meant.
No worries, because I was like,
efficient.
I don't know if the healthcare workers would probably say yes, because it means only one shot for them to have to give, which is another exciting benefit of adherence, because a lot of patients may know they have to return on day 21 or day 28 and may not do so for that second dose and have that full immunity they need to build. So adherence is a big piece. But as far as is that next is AZ and J&J as efficacious, meaning is it as achieving as high of a bar of getting enough antibodies to protect you against COVID. The clinical trial data is not yet finalized, but it's in the very last phase, phase 3. So we look forward to seeing that, and it should be in front of the FDA to review in 2 weeks. So we are hearing preliminary reports that it is indeed as high as the others. And again, with the emergency use authorization, the bar is about 50%. So this should be well in advance of that 50. I'm hoping in 90 percentile as well. Dr. Lagan, what do you think?
Thank you. No, I mean you're absolutely right. The main thing is that really they haven't submitted the final report for the trial, so it's hard to get into any further comment that what you just shared. Thank you.
Yeah. And then I think I'll start with Ms. Lamberton for this. Have there been adverse side effects for the at-risk populations? And before you answer that, something I want to share with our Urban Chamber members and family is that thank you to Joe Cato with Periwinkle. She's also a board member, but her firm was involved in making sure that they identify a diverse population for the state of Nevada. So to that end, that helps us ensure that for a question like this, where we're concerned about at-risk populations and side effects, we've done a good job in Nevada, and thank you again, Joe Cato, for being part of that. But again, Ms. Lamberton, to the best of your knowledge, have there been some adverse side effects for at-risk populations?
Thank you, Ken, for that question. And we are capturing and we are hearing any adverse reporting or any side effect, whether it's arm soreness or if there is an allergic reaction like we've seen in some of the media reports. All of that is reported, and immediately our companies investigate and determine, is there a correlation to whatever incident was reported and the potential for that vaccine to have caused it. And they look at a number of things. The epidemiologists and the scientists really drill down, because if it did correlate, we want to make sure to improve that safety profile of that vaccine or treatment. So for example, when we saw I don't know if you all remember, but the spinal cord myelitis, which is basically inflammation of the spinal cord, occurred with one of our vaccine candidates. Things immediately halted for weeks because 2 people reported with this. And one lady, unfortunately, had undiagnosed multiple sclerosis. So she did have her spinal cord inflamed because of that. The other one was not related to the vaccine, but I'm so proud that our industry said, time out. I don't care if there's a pandemic. We cannot rush this. We want to make sure. So all that to say, I'm not familiar with the complete list of all that's been reported of any side effects, but I know that we have a great infrastructure in our public health system to collect that data from the providers that are seeing it on their patients. It's also another system that collects it from the patients that report it. And again, our duty is to safety profile monitor it up to 24 months and later after that vaccine or medicine is approved. So our job is not done at approval. We go for years in what I call phase 4 clinical trials to make sure safety is sufficiently monitored.
That's great to know. Related question, if someone is on a live agent medication, example, Humira, Entyvio, Xylogens, et cetera, that already challenges their immunity, how will this vaccine affect such a person? And I'm not sure who wants to dive in on that one.
I'm going to defer to our physician.
Well, theoretically, it shouldn't affect those medications because the way those vaccines work, those are RNA messenger vaccines that go inside the cell, and they don't really affect the system. So that's the more generic answer to that. But I will go back to what I said before with your previous question. For patients who are suffering from some chronic or immune depressive conditions, or who are using a specific medication that raise those particular questions, the best source that they could have is their attending physician, because the attending physician knows their condition better than anyone. And there might be elements to the condition that they are not fully aware of. It's not just the medication, so they really have to go back and get that consultation.
Okay, thank you. And then I'm going to ask a related question. It says, I've read that mRNA vaccines have been studied for decades for viruses and as a cancer treatment. None of those has been approved. Why not? Have the two current vaccines been approved simply because of COVID's emergency status?
I think that's a great question. And Ken, it is true that mRNA technology has been available since the 90s, and it has great applicability to the oncology space. Oncologists are thrilled that mRNA has made a resurgence since we've seen its use and, of course, approval in the COVID space. But I do plan, I can imagine and predict that we're going to see other approvals in cancer drugs in the very near future with mRNA, because if our genetic code can be leveraged to produce antibodies for COVID, could it be used to fight against a personalized cancer gene? And the answer is yes. This is like a wonderful use. And so I think if there is a silver lining or a blessing in disguise with this pandemic, I think that is the number one that I could highlight in the scientific innovative realm.
Okay, very good. And I'm going to go back to the chat room now. The question is, do people with disabilities get a higher priority than the general population? And Dr. Legan, I'll defer to you on that one.
Right, thank you. Well, the health district is planning to open a site, most likely as our main facility, that will be dedicated to people with disabilities who actually cannot easily go into the main vaccination centers. So that's something that that will be publicly announced probably in few days. So that's where we are right now.
Okay, and then the next question is, if you have tested positive for the coronavirus in the past, would you recommend those individuals still getting the vaccine?
Yes.
I see both of you nodding in the affirmative.
Yes.
So.
Absolutely.
Okay.
That's a huge recommendation, I know, and Dr. Legan can tell you that as well, but the CDC, FDA, Dr. Fauci and all have said that it's absolutely important, because we don't know what the titer level, meaning how much antibodies are in your body. What mine could be different from yours. You could have more, Ken, than myself. And so
Right.
we need to make sure we, especially as we see these new variants coming from South Africa and from Brazil, we need to make sure that we're all immunized as we see mutations, as viruses do mutate, but we want to make sure that we have as much immunity in the community as possible. So absolutely 100% sure, yes, you will want to get that. But of course, confer with your healthcare provider like Dr. Legan to ensure that it is indicated for you.
Okay, and then the question here, and I think we covered this a little bit before, but we'll just come back to it. There's an individual, they're only 33 years of age, so what I assume is they're not going to be on the right side of the chart that you showed, Dr. Legan. So would it come down to if they're a frontline worker or an essential worker, if they're that young at 33 years of age?
Okay, well, if somebody who is that young, the only way that would be up in the priority lane is if related to the occupation. So they have to look at the left side of that chart and see whether they are either healthcare provider or they are a first responder. I mean, police, fire department, EMS, or they are in the education sector, or any of the groups that are actually mentioned there. But if the person doesn't fall into any of those, certainly they have to wait for their age group to be called.
Okay, thanks for the clarification. All right, I'm going to go back to the question and answers, and what we will attempt to do is document both the chat room questions as well as the Q&A, and then if there's a way for us to get answers to it and again distribute that, we'll work with our pharma partners to do such. Next question is,
and can I add one interesting thing? Interesting breaking news that has happened during this webinar. President Biden just authorized an additional purchase for 200 million more vaccines, 100 million from Pfizer and 100 million from Moderna. And this is huge because we've been hearing there's not enough supplies and vaccines to go around, and we're so relegated to those prioritized populations. This is really good news that just came over the wires as you're on this webinar. So just wanted to make that quick announcement.
Breaking news at the Urban Chamber. So that's why we tell people to join us. Next one is, why do we need different vaccine versions? Is it related to efficacy, or is it because then each company can produce their own, making it faster? Sharon?
Well, I would just say that it's really important, Ken, I believe, that we have as many vaccines and as many shots on goal, because if, God forbid, there turned out to be something we don't know about some of these vaccines, we have more shots on goal, we have more options. And while the safety of this clinical trial data has been improved, it's a snapshot in time, like an EKG of your heart rhythm. It's for this very moment in time. The FDA has said, given the pandemic and given this clinical trial data of 30,000 individuals, we believe this medication is safe. But as we learn more, we may need to know that there are other options. And as more countries who can't afford 70 degree below refrigeration, I mean, those things are expensive to buy those refrigerators. And who's the refrigeration police making sure, it's really -70? So I would say we need to keep chugging along and having as many treatments out there as possible too, because some people will not be able to get, or have not been able to get the vaccine and then get COVID. So what are those treatments like monoclonal antibodies and other things that Dr. Lagan could prescribe if they are landing in the hospital? And they can reduce hospitalization from like 21 days to 7 days and really reduce the severity of symptoms. So if that's my mom or my dad or my loved one, I sure want those options. So I'm just cheerleading all of our companies on, any company that's developing these medications and vaccines. We need as many as we can.
Okay.
Yeah, Ken, right. I wanted to add that this is not unique to COVID. I mean, most of the regular vaccines in our immunization program, whether it is for measles or any other condition, they have multiple manufacturers. So that's not unique for COVID. It's common practice.
And I'll ask this related question. It says, with mutated versions, and Ms. Lamberton, I think you touched on this, with mutated versions of COVID-19 spreading across the U.S., how will the efficacy of the vaccines change, or are they expected to change as a result of the mutated strains? And then the other related question is, as with other shots, will this become a shot that you have to get on an annual basis?
That's a great question, Ken. Your participants are so very smart and tuned into great questions. Number one is that we do think that from everything we've read as of yesterday and heard from our scientists, that these mutations will be, that if you do the current vaccines that are out there, which are only 2, they are efficacious against the new strains. There have been studies. Are they 100% or 95, or as it was 94.1% effective? No. So they are less effective, but there is some coverage per Dr. Fauci and CDC and FDA yesterday. So we do know that, thank God, there's some efficacy with the vaccines that are out there for these new variants that we are seeing. That's reached St. Paul, Minnesota yesterday with one individual that came early January from somewhere. They're still tracking his travel, but somehow that's in St. Paul, Minnesota. That person has the Brazilian mutation. All that to say, we do know, even with partial efficacy for those vaccines, we need more. So yesterday, you saw Moderna say, you know what, we're going to commit to coming up with a booster for those variants. So I was so happy to see it's not our company, Moderna isn't, but they stepped forward and said, this is crazy. We got to address these new variants, not just the one that came out in December, last December. We need to have something new. So yes, I do think that thank God it's partially effective, but we need more.
And will they be an annual shot like the booster you mentioned? Would that be a booster that you take, say, a year from your initial
So the FDA has not been able to say whether or not that will be something like the U.S. Preventative Task Force issues, that you have to get your tetanus every 10 years or you should get your flu every year. It has not been able to rule that because we're still in the early stages of research of the virus and the vaccine. So not enough data to answer on that yet.
Understood. Let me ask Dr. Ligon, what recommendations do you have for seniors, especially if they have underlying conditions and they're having difficulties getting a vaccine appointment?
Well, the seniors, they have two different ways to get an appointment. One is through the mass vaccination site that I mentioned before. And also the second one is through the local pharmacies, Walgreens and Smith pharmacies. They are offering the vaccine, and that's a way to receive that. In addition to that, there are a local intervention from local government here, where they decide to go to, let's say, senior community centers, yeah, at the localities, and offer the vaccine there. That's I would say those are the main venue for that. In the near future, we also will be offering what we call mobile units for vaccination, and also what we call strike teams going to small facilities or locations and targeting specific groups. But right now, for the seniors, again, the pharmacy is one, and the second one is the big size, and the third option is just through the local government. Like right now, we have the cities of Henderson, Las Vegas, Las Vegas, offering vaccine to the community on site that they have opened there, which is a smaller size than the big ones that we have in collaboration with the county. So those are opportunities, and there will be more opportunities in the near future as the allocation of vaccines grow. So that's the main limitation right now. Really is the vaccines here, and I'm glad that Sharon just mentioned this new agreement of $200 million, but really 200 million doses. Sorry. But the limitation is the vaccines. If we have more vaccines, there are more interventions that we can do, and we can diversify the way people access the vaccination.
Which is great news. So again, the breaking news, thank you again, Ms. Lamberton, for that information that President Biden authorized the purchase of more vaccines. Last question in the chat, it's a clarification question, is Sharon, did you say the J&J vaccine is just one shot versus 2 shots?
Yes, that's what we understand, just the one shot. And it's using the cold virus, the adenovirus that we used for the Ebola vaccine. So very exciting, different, there's different benefits, pros and cons to like the mRNA. You need less of the vaccine. You might have longer lifetime immunity with mRNA. We're not sure. But certainly, there's a lot of as many choices as we can to have out there for the recipients and for different countries. It's so important as we look beyond our borders to keeping others safe as well.
Okay, and what I'm going to do as we wrap up here, because we do want to be timely, is I'm going to combine some questions as best possible. But I think the other thing we'll do is to the individual that submitted them, again, we'll make an effort to document them, work with pharma to see if we can get some responses, and then email as well as provide that at our COVID-19 website. But again, I really appreciate this. So Ms. Lamberton, how long are the clinical trials? What do we know about, and I think you touched on this, the potential long-term effects? It's still early. And then in addition to that, how long do we think the vaccine's efficacy will last? 1 year, 5 years, or is it still early for that? But let me be quiet and let you address that.
No, you're awesome, Ken. I would just say that we do not have that data yet to tell you if it's going to be lifetime or 6 months or a year. So we're hoping to get more. But clinical trials vary, as far as how long it takes. But we have up to 30,000 participants that are enrolled in those clinical trials, and it includes 3 phases. I did want to mention to your viewers and to your wonderful members of the chamber, we have a couple websites I'm going to send over to Jennifer that Hannah and I really think are just stellar, that will answer some of these hard questions. Like if you only had 20 minutes to look at the tough questions and answers, there's some one-stop shopping websites we're going to send you to.
And that'll be great. And we'll make sure that we email them out as well as to the participants, as well as our global database. And then we'll also make links or post them accordingly at our COVID-19 resource site. Dr. Legan, the last question I'll ask you to address is, I'm going to paraphrase it for time, but the concept of herd immunity, how will that impact, or will vaccines contribute to herd immunity?
Sure, thank you. Well, I mean, the concept is that within a given population, if you have the right number or proportion of people immunized or vaccinated, just by having them protected, that also conferred a higher degree of protection to the ones that are not vaccinated, because what you are doing is interrupting the transmission of the disease in the community. In this particular case of COVID, the discussion has been what is the minimum level needed of vaccination in the community. And initially the talks were about 60–70%. The last thing I heard, it was like 80% or 90%. It's just estimates which is the right proportion, but really the idea is that if let's say Clark County, 70% of the people are vaccinated and immune to the disease, it contributes to just eliminating the transmission of Clark County, so the virus is not circulating any longer, because if somebody is infected, there is no a second person to infect, because that second person is already protected. So the transmission stops there, and eventually it just goes through the whole community, and the disease disappears from the community. That's the idea we heard.
Excellent, excellent. Well, we're nearing our appointed time, and what I want to do at this point is say thank you very much, Dr. Legan. Again, he's the Chief Medical and Health Officer for the Southern Nevada Health District. I also want to say thank you very much to Sharon Lamberton. She's the Deputy Vice President for Pharma, which is an association that works with some of our major pharmaceutical companies across the country. And for that matter, I get the impression you have a global presence as well. Thank you again to Hannah Green from Pharma, as well as Jennifer Zinn from Zinn Public Affairs. Definitely want to say thank you very much to my staff, Delisa Stewart, Rashonda Washington, and Carissa Samail, for making sure that we were able to do this today. Great information, and again, I think we accomplished our 2 objectives. Number 1, make sure that we get some credible, factual information out there so that you can make informed decisions for the number 2 objective, which is to make sure that our businesses are in a position to protect the business owner, the employees, and the clientele ultimately. We want to make sure we're in a position to do that. So thank you all very much. What we will do is we will save the chat questions. We will also save the Q&A questions. We'll be pushing out some links to get the information out there. We'll work with our pharma partners to get links, information, as well as questions answered that were brought up today, because we're sure there are other people out there that unfortunately they may be talking amongst themselves, so we want to get this information to them. So with that, I want to say thank you all very much for being part of today's discussion. Thank you to all our participants. As always, the Urban Chamber seeks to be a portal and a platform to information and resources like what we were availed of here today. Thank you all very much.
Thank you.
Enjoy the rest of your day. And
Bye.
Bye.